Hi, I'm naturopathic Dr. Samia McCully. So what's the deal with gluten? The other day I talked about food sensitivities and something that is incredibly prevalent in our society, and that's because food sensitivities can be caused by many different things like stress, just poor diet, antibiotics, even gluten. So gluten, which can also be tested, sensitivity can also be tested for in the standard food sensitivity test I use, is something that is incredibly common. It's not a fad, which is what a lot of people think, that everyone's just jumping on the gluten bandwagon. So why isn't it a fad? And what is the deal with gluten? Well, about 50 years ago, wheat used to be very tall and top heavy, and farmers would lose a lot of money because the wheat would fall off, and so they'd lose a lot of their grain, and they couldn't obviously make money on everything. So what they've done is that they've chosen for wheat that is shorter and more bottom heavy, so they don't lose, they get more financial benefit from raising certain kinds of wheat. And just like we have done with apples, I know when I was little, apples were not all incredibly sweet. In fact, they were mostly tart. And now every apple I bite into seems incredibly sweet, just like strawberries. They're huge and they're sweet and they're juicy. And I remember tiny little strawberries, misshapen, not perfectly formed. So that's what we've done with wheat. And with that comes the changing of the protein in it as well. And so if you liken this to a chemical, so we create over 2,000 new chemicals and introduce them into the environment, into our food, into our skin products, our home, like dish detergent and things like that we're exposed to. And so we're exposed to more and more chemicals every year. And when we have gluten, which and the protein of it has changed significantly since our, the 2,000 or the 10,000 years or so that we've been eating grains, and our bodies have gotten, have developed some ability to digest gluten, not everyone, in that time because of evolution. And because we've changed it so much over the last 50 years, a lot of us don't have the ability to process it because it's just like a foreign chemical. It looks just as different to our bodies, and they don't know what to do with it. And humans do not evolve, populations evolve, and we certainly don't evolve in a 50-year period. Something else that's interesting, I have lots of patients who go to Europe, and they all tell me when they go to Europe that they are perfectly capable of eating French bread and drinking wine in Italy and having cheese in France and wherever else. And then when they come home, they can't digest the gluten, or they can't digest the dairy, or whatever it is. And the reason for that is because a lot of other countries have resisted the change to food that the United States does. I mean, our food is a business, and we will do anything we can to make as much money as we can from it. So gluten sensitivity is not just something that's popular that people think they feel better. They do actually feel better. Not everyone. Some people can digest it perfectly fine, but a very large percentage of the population does have a problem with gluten. And one of the problems is that because we have conventional medicine really only looks for celiac disease, and a very small percentage of the population has celiac disease. So if someone goes and they have all these digestive issues, or they have other issues, and they get tested for celiac and it's negative, they think, oh, well, I must not have a gluten problem. But what they can do is come and get a food sensitivity test, and gluten and all the different gluten grains are included in that test, so you can find out in detail if there's something going on that you can help by removing gluten. If you have any questions, please make a comment on the YouTube area below, and we would be happy to answer them. If you'd like more information, just check out wellnessarchitecture.com.